Today we're covering medication safety and error prevention, but critical topic heavily tested on the NCLEX. The exam will not ask you to simply list the rights of medication administration. Instead, it will present a scenario where a nurse is about to make an error, and you must identify the break in protocol. For instance, a question might describe a nurse who correctly scans the patient's wristband but fails to ask for a second identifier like name and date of birth before administering a benzodiazepine. The correct answer would be to intervene because the principle of using at least 2 patient identifiers was violated. This is a classic right patient error scenario. The NCLEX expands beyond the basic 5 rights to include the right reason and right response. If a patient is prescribed an antihypertensive but their blood pressure is already 90/60, administering the medication is an error. Even if you have the right patient, drug, dose, route, and time, you must apply critical thinking to the clinical context. High alert medications are a favorite NCLEX topic. These are drugs like insulin, heparin, and potassium chloride, which have a high risk of causing significant patient harm when used in error. The exam will test your understanding of safety protocols like the independent double check. A common trap is a question where 2 nurses look at a syringe together to verify the dose. This is not an independent double check. The process requires 1 nurse to calculate the dose and a second nurse to independently perform the very same calculation without seeing the first nurse's work. Only then do they compare their results. If a question asks for the best way to ensure safety when administering intravenous heparin, the answer will always involve this specific independent verification process. Look-alike, sound-alike drugs are another area where exam questions are designed to trick you. Imagine an order for Celebrex, an anti-inflammatory for a patient with depression. You should recognize that the provider likely meant to order Celexa, an antidepressant. The NCLEX expects you to act as a final safety net and question an order that does not match the patient's diagnosis. You will see questions testing your knowledge of tall man lettering, like using hydroxyzine versus hydralazine to prevent these mix-ups. Always use both generic and brand names during patient handoffs and when verifying orders to avoid confusion. What about technology? Barcode scanning is a key safety feature, and the NCLEX loves to test what you do when it fails. If a scanner is broken or a medication won't scan, the wrong answer is to manually override the system and proceed. This is a red flag for an unsafe action. The correct procedure is to stop, manually verify the medication against the medication administration record using the rights of administration, and then follow your facility's specific protocol, which often involves getting a new barcode or contacting the pharmacy. Patient safety always trumps convenience. Finally, let's discuss what to do when an error occurs, because this is almost guaranteed to be on your exam. Your absolute first priority is always to assess the patient. Before you call the doctor, before you tell your charge nurse, and certainly before you fill out an incident report, you must check your patient for any adverse reactions. An exam question will present a scenario where a nurse gave the wrong dose and ask for the immediate next step. The correct answer is always related to patient assessment, such as checking vital signs or blood glucose levels. To remember the sequence of actions after an error, use the phrase "assess now," inform right away. This stands for assess the patient, notify the provider, and then complete the incident report. The incident report is an internal tool for quality improvement. It is never mentioned in the patient's medical record.